Hello and welcome to my new channel. My name is Dan. I'm a junior surgeon working within the NHS part-time as a locum. I previously quit being a doctor for a while and held a position as the chief of staff for a private equity firm in London. For those that don't know, private equity being a type of investment finance. I'll go into a bit more detail about what that is down the line. Today, I'm going to take you on some of my journey from the operating room to the world of private equity. I'll touch upon why I got fed up and left the NHS and medical work, and I'll briefly cover what drew me to the investment finance. It was a huge decision, which at the time came after 7 years worth of training in med school and as a foundation doctor. I know I'm definitely not unique in some of the emotions and sentiments I held working within the NHS. No doubt many of you may be going through some of the same thoughts that I had at the time. I hope it's some use to you, or if you just fancy a nose through my story in general, well, you're more than welcome. So, to go back in time a little bit, back in 2019, I made the move. I left behind my scrubs and went headfirst into the world of finance, landing a gig as the chief of staff for a private equity firm. Getting there filled me with angst in whether or not I was making the right decisions. There was many arduous exams and interviews and uncertainty that lay ahead. So as a bit of background, many will know that the path in medicine is often very prescriptive. You're 16 years old, sometimes younger these days. You're having to decide what you want to do for the rest of your life. You don't know your head from your ass, but you keep repeating the words, "I want to help people," over and over again until you manage to convince yourself that you want to be a doctor. You apply, you jump through the hoops, you get this work experience and that work experience, and you're sure you definitely want to do medicine. You get an offer to attend the fourth choice of med school by the skin of your teeth, and you're hugely grateful for the opportunity. You take it seriously enough and mash through 5 years with many hiccups along the way, and finally you're there, a freshly minted doctor. You still don't know your head from your ass, but you've got a few more letters after your name, and you can change your prefix on your driver's license. But you and your mates stand around calling each other doctor, and you feel all giddy.
Doctor?
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 So you're there, like a fully grown, barely grown, not even remotely grown adult, and it's shit. You're a glorified scribe. 5 years of med school didn't remotely prepare you for the onslaught that is your first acute medical night shift alone as an F1 doctor. The one thing you may not have admitted to yourself, I definitely didn't at the time. For whatever reason, your personality gets drawn to that safety of being a doctor. It's not rocket science, I guess. You get paid okay, maybe not what you deserve, but you will be able to put food on the table and turn the lights on. There's always a need for doctors. Maybe one day you might get a few bucks as a consultant at the end of training, but that's like 10 years away. But you like that you know your career path can be easily defined in front of you. As medics, often we like that it's that prescriptive. It may not be easy, but you know exactly what you need to be doing to get to the next stage. Progression is very clearly defined in its requirements, which can be frustrating because there's no such thing as progressing on merit. If you're amazing at your job, cool. You still carry on at the same rate as everyone else. But if you're shit at your job, but you manage to tick those prerequisite boxes, well, go on ahead, pass go and collect 200. Doesn't matter if you're a crap doctor and have the communication skills of a potato. But as you progress through med school, foundation years, core training and beyond, if you've discovered a speciality you like, then all you have to do is follow the guidelines, tick the boxes, and you'll get to the next stage. We'll gloss over the fact that actually doing that is, pretty shit and hard. Obviously a massive oversimplification, but the point stands. It's all hugely well defined, it's safe, it takes some of the thinking out of it because you know what's scary? The unknown. Having to work out on your own accord what jobs exist, what the path along the way may look like, what you have to do to get into the job, but then to carry on up and through. Medicine, surgery, general practice, and all the other subsects of doctor life make up actually only a small number of jobs in its entirety. We as medics can often comfortably say we like barn door medicine or community practice or surgery, and we can mash our way through training to find something that roughly resembles our interest. The rest of the world wades their way through far more uncertainty. Unless you take a vocational job, the majority of the workforce wings it as they go along, based upon goals and whims and vague interests. People fall into jobs and work their way through careers that bring them satisfaction. It's uncertain, undefined, unknown, and scary. It's weird for us medics, but it's so normal to the rest of the world. Obviously, these are big blanket statements and aren't completely true of everyone or a summary of what it's like out there. But hopefully you can understand the point that sometimes it's difficult for us medics to see a life outside of the well-defined paths of medicine, and that there's many other things out there, many other opportunities in that vague uncertainty. The reason I mention this is to explain partially why I'm sharing my story, because I know there's many out there who might be standing at a crossroads in their careers, wondering if there's life beyond medicine. Well, spoiler alert, there absolutely is. Now let's rewind a bit. Picture me, a freshly minted doctor, knee-deep in the chaos of the NHS. I loved some of what I did. There was tangible benefit in some of the work I was doing, albeit getting very bored of VTE assessments and TTOs. I started noticing patterns though that I couldn't shake the feeling that there were root issues plaguing healthcare in the NHS. I mean, it's no illusion, many of you are entirely aware. This isn't a especially well-kept secret. I grew more and more frustrated by poor staffing, compromised rotas, the onus and burden of patient decision-making on the most junior members of staff due to ineffective and inefficient systems, poor training and a lack of training opportunities in day-to-day work. No one's got the capacity to teach you higher skills. You just have to hope that you absorb enough technical ability by osmosis and being by present remotely close to what's going on. Often I'd learn new clinical skills just by doing them for the first time, rather than any formal training or teaching. A tale I'm sure very familiar to many of you. It used to be see one, do one, teach one as far as learning these skills were concerned. But these days it's more like just do one, in every sense of the phrase. I know things at the trust I work at now are marginally better than when I was in F1 a few years back, but I see the burnout is still very real. What's even sadder is that as time goes on and you progress through training, it doesn't seem to get any better, with more onus being put on yourself to juggle more and more to get to the other side. You mention things to your colleagues and superiors, they nod knowingly and sympathise with your plight, and they agree that things aren't exactly right. Nothing changes though. And often hands are completely tied as far as what can be changed, and the issues that plague the system, they're fundamental and come from high above. We won't get too political, but there are structural inefficiencies and management decision making that makes it tough to get good outcomes for patients. So what do?
You a grown ass man, stop being a little bitch!
Well, either you say it's shit, but it is what it is, you crack on with the job and you make the best of the situation. Or it frustrates you, it eats you up inside and you want to change it, but you're met with a brick wall to achieve any of that change. You kick and you scream, but you're only winding yourself up, and you make yourself more and more miserable. I wish I was in that first group, but I was distinctly in the latter. It beat me down. I became so apathetic to such a flawed system, I just wanted out. I couldn't see myself working full-time for the next 11 years to become a consultant. Forced through that system, compromising the care I was giving to my patients, and compromising myself day to day. I know it all sounds very doomsday-like, and it's not to bring either the NHS down or anyone that works within it. It's purely a reflection of my own resilience to the crap that gets thrown at you, and my priorities from what I wanted out of my working life. So I did what any sane person would do. I quit.
I quit!
Somebody help him out, for God's sake.
Not without starting to get some sort of insurance policy though. So at the end of my foundation years, whilst working in general surgery, I started expanding my knowledge into other careers, specifically investment finance. I sat an exam called the CFA, or the Chartered Financial Analyst Level 1, and managed to make some contacts. At a different point, I'll go specifically into what the CFA is and why I decided to sit that. But for now, as a quick summary, I'll say that I've been fascinated with finance for a long time. Always been that nerd who got off on solving that satisfying maths problem at school. The private sector, the corporate world, is how the world works, including, unfortunately, the NHS, just very poorly. Gaining some insight into that world really helps you actually see how the world works properly. And, the money helps. Walking into the office on day one, I felt like the ultimate imposter though. I mean, who was I to be sitting there amongst all these high flyers pretending that I fit in? I always joked that the week before working within private equity, I was on a surgical night shift, trying to get 10 minutes of sleep on the doctor's office floor. And then the very following week, I was taking private jets to the next work location. The contrast was pretty stark. That's a real superficial sneak peek into my journey. But this is just the beginning. I'll work through these videos and explain a little bit of why I chose to go into investment finance, why private equity, and for those that don't know what it is, a little bit about what private equity is, what life is really like in the world of investment finance. It's not that fancy and glamorous, it's pretty shit sometimes as well. And then I'll also talk a little bit about how I managed to get the job and how to position yourself to be attractive for opportunities outside of medicine. Before I sign off though, I want to hear from you what burning questions that you might have about my journey, or specific questions you might have about careers outside of medicine. I may not know the answer, but I can always find out. Drop them in the comments, and if you like the video, please share to anyone who might find it useful. I'm sure you know many doctors that have left medicine and tried different careers, and unfortunately it's becoming super commonplace. I wouldn't mind getting a few on the channel. I know a few people who are in management consultancy, a few in investment finance, a few in the pharmaceutical sector. So we'll get them on and we'll have a little chat with them and see some of their insights and hear some of their stories as well. If you want to hear more about this journey and some of my insights, subscribe and I'll get started on the next video. This is my first video, so just take it a little bit easy. I'm always open to a bit of feedback though. Until next time, take care.